Thank you, Mr. Chairman, and thank you to our witnesses. This has been a very useful hearing, and I think we've covered a lot of ground here. And it's a hugely important topic, something that I hear about from my constituents all the time, and you've heard, I think, a lot of bipartisan agreement today, as there has been on this topic for a long time. So I do hope that we can move forward on some of the thoughtful recommendations and ideas that we've heard, not only today, but over the last several years. And as this hearing comes to a close, I do want to take a minute to bring it back to where we started, which is we are in a healthcare affordability crisis, and transparency is a part of the answer, but it isn't all of the answer. And I so appreciated the comments from Mr. Auchincloss just now about prior authorizations. That's something I hear from my constituents, both the physicians and the patients. I represent a lot of physicians. I represent Houston and have the district right outside the Texas Medical Center. So I have a lot of physicians I represent who are so frustrated that they can't give the patients the care they need, and they spend so much of their time trying to get authorization for the care they know their patients need through the insurance companies. And I think it's this overall transparency. We had a conversation just the other day about the challenges and kind of the shorthand of Medicare for all, which of course is just the payer side of the equation. And there's so much else that we don't understand. And I think it's a shorthand for healthcare for all. Everyone should have access to affordable healthcare, and they should be able to get the care they need and understand the costs, the rationale, the coverage options that they have. So the conversation about Medicare Advantage, also hugely important. But as we know, healthcare costs continue to go up even with all of these good legislative ideas, and we cannot ignore the fact that a huge part of the reason these healthcare costs are going up is because this is an ecosystem, and the decisions that this Congress has made in the last year and a half to drastically cut funding for Medicaid, which the estimates are that 10 million Americans are going to lose healthcare coverage because of those cuts, but also the elimination of the tax credits relating to the Affordable Care Act's enhanced premium tax credit program. In my district, that was 125,000 people who were relying on those tax credits. And so they're facing increased costs. They're getting worse plans for more money and less coverage because they can't afford their health care. And it's estimated that that's more than 4 million Americans that are going to be in that situation. And they don't even cover, those numbers don't cover the people who are forced to change their plans because they're all becoming more unaffordable. I know too, hearing from the folks who work in our hospitals in Texas, where we already have the highest uninsured rate in the country, as I'm sure you all know, that those rates are going up even more, and that our hospitals are seeing an increased number of uninsured patients, and that's increasing their uncompensated care costs. All of this is an ecosystem, and what decisions we make in one area affect decisions in another. And so as we work to address costs and transparency, we also have to address what is driving up costs, and it's just one piece of it. And so I do think it's critically important. I feel like we've heard a lot of really interesting and important testimony today. And so, Ms. Tripoli, I just want to end the hearing and my time with you with a question. I know you've answered a lot of questions already today, but if you could just answer whether there's anything you feel like we didn't touch on in the hearing today about how healthcare consumers that you work with and your organization works with have been impacted by these healthcare cuts. If there's anything that we haven't covered in this hearing today that you think is important for us to know, or any most salient points you just want to make sure that we have clarity on as we end this hearing.
Thank you. I mean, I would say first and foremost, consistent with what we have talked about today is that there's a suite of legislation discussion draft, a discussion today, much of it which should move forward and is an important step in addressing the affordability crisis. Not sufficient, but a majorly important step. Second, in terms of the cuts, we know that the cuts, obviously the $1 trillion of healthcare cuts in Medicaid are having an incredible harm on people. Up to 10 million people are likely to lose coverage. We just saw an interim final rule come out from the administration just a couple weeks ago, going even further than H.R. 1, putting paperwork upon paperwork for beneficiaries to maintain their Medicaid coverage. And we are now going to see, we're already seeing the effects of what happened with the expiration of the enhanced premium tax credits. Over 1 million people less enrolled this year than last year because those tax credits did expire. And as the final data comes out over the summer, we expect to see that much higher. So there is significant harm that's ongoing and that we will continue to see this year from the HR 1 bill that was enacted last year, as well as the failure to extend their premium tax credits.
Thank you, Ms. Tripoli. And with that, I've gone over my time, so I thank you, Mr. Chairman, for allowing me to ask that final question as we close the hearing. Thank you, and I yield back.